Hi, welcome to It's Your Move to Better Health. I'm Lana Kelly, and I'm here today with Margaret Nunziato, who will be telling us about some programs that she is working with at Westchester Independent Living Center and Putnam Independent Living Services. Hi, Margaret.
Hi, Lana.
Thanks for coming today.
Thank you.
So I know you have a very long title, and I was afraid to do it myself, so tell me, what's your title?
I am the Director of Waiver Services, the Senior Regional Resource Development Specialist underneath New York State Department of Health.
Okay, and I know that one of the programs that you are heading up is the Traumatic Brain Injury Program?
Correct.
Could you tell me a little bit about that?
The Traumatic Brain Injury Waiver Program is throughout New York State. New York State is divided into 9 regions, and the lower Hudson Valley is one of the 9 regions. We cover the 7 counties in this region. That includes Putnam County, in addition to Dutchess, Ulster, Orange, Rockland, Sullivan, and Westchester. We provide services, community-based services for adults that are diagnosed with traumatic brain injury. They need to be between the ages of 18 and 64.
Okay, how does a person get a traumatic brain injury? Is there?
There are many different ways. An external trauma to the head, where if you got hit, a car accident, it could occur internally through a stroke. So there's many different ways people could get an injury. Falling, as simple as just walking and falling, you could have a minor head injury.
Yeah. And are there typical symptoms of TBI?
Generally, when someone does have a brain injury, you may see some poor short-term memory or long-term memory difficulties. There may be some problem-solving difficulties, concentration, focusing. There may be some physical issues, whether if it's difficult to use your hands, arms, legs. There might be some effects to your hearing, speech, and even eyesight, depending upon where your brain was damaged.
Okay, that sounds like it could be pretty serious stuff.
Yeah.
What services, say I or a family member have a traumatic brain injury, and I need help.
Right.
What do I do?
Well, the first step in the whole process is to contact our office. We are located in Putnam at the Putnam Independent Living Services. We would do the initial phone intake. Once that is completed, we will make an appointment to come out and see you face to face and do an intake. There is a basic criteria that we do see if you meet that basic criteria before moving on, and that would be between the ages of 18 and 64, having long-term community-based Medicaid versus an exchange or the Obamacare, where you would call and be able to get Medicaid. You would need to actually go into the Department of Social Services and apply. You would need to have a diagnosis of a traumatic brain injury, and that would come from a physician or hospital stay. You would need to meet a nursing home level of care, and how that is determined is that there is an assessment that a nurse would conduct that is called a patient review instrument that would give us a level of care that would tell us that you are at a nursing home level of care. The whole foundation of the program is to either transition people from or divert people to going into a nursing home. And we would need to be able to maintain your health and welfare. If you meet all that criteria, then you would go on to the next step of selecting a service coordinator. And that person would write what we call an individualized service plan that includes all of the services that you would need to maintain your health and welfare in the community.
That's pretty complicated.
Yes, it sounds complicated, but we definitely walk you through each step. The process may take some time. We are not an emergency-based program, so if someone is in need of immediate health care, you need to go to your physician or a hospital to get that immediate health care. Or if you need immediate housing or services, once again, you would need to go to the Department of Social Services, and they would give you temporary or emergency services.
Okay, so this is something that's going to take a few months.
Correct.
To get everything into place. And so you said it's a 7-county program that.
Yes.
Okay.
We oversee 7 counties, the Hudson Valley region. So whether if you are in any of the 7 counties that I mentioned, you would contact Putnam Independent Living Services, and they would direct you to me, and we would go out and do all the screenings.
Okay, and then you said you would then pick a service provider. Would that be the person in your local county or your local area?
When providers that work underneath our program, they are for-profit and non-for-profit providers. And we create a list of all the providers that work in that county that you live. So some of the agencies may be housed in that county or a neighboring county, but they provide services in that county. But you will know through a list.
Okay, but the first step would be to go through Putnam Independent Living
Correct.
Services. Okay, and then it would just be processed through there.
Correct.
And do you do trainings and for the service providers?
Yes, we do. We do numerous trainings for different services that they may offer. We give an overview of different disabilities, of traumatic brain injury. We provide technical support as they continue to work with the participants. But we do have, so if someone is going to be a service coordinator, we provide training for service coordination. And then we do have a nurse evaluator that will help providers with any medical concerns or medical resources that they may not be familiar with.
Okay, so this people have to be on Medicaid for this, so it's income-based. So what if they can't afford these services? Do they have to pay for them, or?
If they're not on Medicaid?
No. If they are on Medicaid.
If they are on Medicaid, then Medicaid will pay for the services.
Okay.
So the providers will be billing Medicaid for the services that we approve for them to offer. So when a participant and a service coordinator writes a service plan, all the services are in that plan with a justification on why they are needed. We review those plans, and if they are justified, we approve them. We notify Medicaid that these services are approved by this provider, and then that provider can start billing that participant's Medicaid. So it's all services are reimbursed through Medicaid.
Okay, and so the next program, Nursing Home Transition and Diversion Waiver Program, NHTD. What is that?
That is very similar to the traumatic brain injury. The difference is the populations that we serve. This program serves people with physical disabilities and or seniors. You have to be 18 years or older. We cover the Hudson Valley region again, and the criteria is basically the same as the TBI waiver, where you have to have long-term community-based Medicaid, you need to be nursing home level of care, you need to have a diagnosis of physical disability or be a senior above 65. We would need to maintain your health and welfare, and you have to be at a nursing home level of care.
Okay. What about the availability of affordable housing for individuals with these needs? Is there housing available?
Well, it depends upon the area of where people choose to live underneath this program. They choose who they want to work with, choose who they want to live with, and choose where they want to live. There are more available housing in certain locations. When people choose to live in more rural areas, it may be a little bit more difficult to find accessible housing or housing that meets a fair market value if someone is on a subsidy or Section 8. It depends upon their physical abilities. If they are dependent upon accessible transportation, or if they have to walk to get to stores. Then we have to look at where their needs would be met. So we do find housing. Sometimes it may take a little bit longer, but it definitely is one of the barriers that we have to face regularly.
Right, right. So there's a lot to consider in this program, and even just choosing where you want to live, you have to make sure that there's public transportation or that you can get where you need to go. And
correct. And for staff to be able to get to you.
Yeah.
Some of our staff utilizes public transportation to get to and from the people's homes. So if there isn't a train, bus, or other affordable transportation, it may be a little bit more difficult to find transportation. So that, yet again, is another barrier for some people.
Yeah. Margaret, there's so much in the news today about sports and concussions and long-term effects of not treating a concussion. Could something like that lead to a brain injury?
Concussions are very serious, as we have heard lately. People in football, boxing, soccer, and if someone does not take a concussion seriously, it can have long-term effects. Depending upon the severity of the concussion, someone could be at total rest, no stimulation to your brain for quite a period of time, and that includes no reading, no watching TV, no video games, sitting out of those activities. We have seen better helmets. We've seen improvement with bicycling helmets and having helmet safety awareness days, and even soccer now has specialized bands that children can wear. It's a very serious thing, and I think that in the past it wasn't seemed to be as serious as it should be, and now we're seeing some long-term effects as people grow into their adolescence and adulthood, not having concentration, their behaviors not being able to focus, lack of motivation. So there are some effects if you do not take care of what the doctor or physician states.
Right. So you really have to make sure you take care of your brain, just like you would take care of your arm if you broke it or your leg. We have gotten to the end of our time here, believe it or not. Our time is up, and it was really interesting learning about these programs, and people can contact you at Putnam Independent Living Services, which is based in Brewster, and at Westchester Independent Living Center, which is based in White Plains, to get started with more information on these programs, right?
Correct.
Okay, great. Thanks a lot, Margaret. Thanks for coming today.
Absolutely.